Good evening, everyone. Thank you for joining us tonight. Just to get your attention, these are not binoculars. Have an idea what they might be? They're a flask. Exactly right. If you haven't taken a moment to step into the resource officer's room where they're teaching CPR and showing you things like this, really interesting information in there. I showed one to the police officers who said, well, we usually don't mess with the young lady's tampons. This is also a flask. And they have a few in there, the Vice Squad. This is water on top, not in here. It's a hiding place. That's from the Vice Squad. This is not conditioner. It's sold this way on Amazon. If you Google booze flasks or fake flasks, these things are designed, they are marketed to kids to hide them from the authorities, to hide them from you, to hide them from parents. This is not an umbrella. We could go on and on like this. All right, I'm gonna show you one more thing. Sorry if I had a flat table. Okay, there goes the water. This is not a cell phone. Looks a lot, thank you, a lot like a cell phone. It's a flask. So you get the idea. We'll have some of these things in the other room. So you're here tonight because Arlington County has a problem. The whole country has a drug problem, and we're here in this room because we care and we want to fix it. We had our first town hall back in October, and we talked specifically about opioids and how they're affecting our community, and we got feedback from people in that meeting that you wanted to know exactly what is Arlington County doing to fight back against drugs, what are the schools doing for our student population, what resources are available for addicted individuals and families, especially as they try to enter into recovery, and what each of you in the community can do. So we want to answer those questions from you. We're going to talk to our panel of experts here. They will each present some information, and then we want to make time for you to ask any question you might have, and we have microphones in the front of the room. So really, we wanted to save the last 40 minutes or so for that, but if a question occurs to you and you need to ask it right now, please feel forward. Please feel free to come forward. We want you to know, and maybe you already know, that drug use has no color, no income level, no age, no look. We want to help remove the stigma that people with drug dependence are the others, that they would not be anyone that you would be in contact with. They are people we know, they're people we admire, they're people we love, they're people we care about. Oftentimes, if we could let them see their own potential, we could help them. Drug abuse, drug use affects everyone, and we want to stop adding photos like these. These are all people who have died. These are all children who have died from drug overdose. In 2013, drug overdose took over as the leading cause of unnatural death in Virginia. No more was it gun-related incidents. No more was it automobile accidents. It was drug use. And we're talking about prescription drug use as well as heroin and illegal drug use, the opioids. Opioids have been the driving force behind the large increases in fatal overdoses since 2013. If you picked up this pamphlet as you walked in, opioid treatment in Arlington rose 245% between 2015 and 2017. We're doing this to ourselves. And we need to find a solution, and we're going to find a solution ourselves. In 2015, statewide, the number of illicit opioid deaths surpassed prescription opioid deaths, and the trend has continued into 2017 and 2018. Fentanyl caused or contributed to the death of over 50% of fatal overdoses in 2017, Rural areas of Virginia have the highest mortality rates due to prescription opioids, but urban areas like Arlington and our area have the highest mortality rates due to illicit opioids like heroin. Virginia experienced the largest increase, Virginia did, in the entire country, 38% in the number of fatal overdoses on record in 2016 compared to 2015. We have a crisis. The Virginia State Police have identified the 7 top drugs seen in Virginia: cocaine, marijuana, heroin, Xanax, fentanyl, methamphetamine, amphetamine. This one, when we look at the overdoses and the record of overdoses between 2013 and 2017 from heroin or other opioids, in 2013, Arlington County saw none. In 2014, Arlington saw 7. 2015, 8. 2016, 42. 2017, 74. It's a trend we have to stop. Tonight, we are joined by an amazing panel here of people who are experts, people who have been heartbroken by this epidemic. I want to begin by introducing Mark Atwood and Ginny Atwood-Lovett, who have dedicated their lives to saving other families after they lost their son, their brother. Ginny found her brother, unresponsive. He had become addicted to heroin at the age of 15. Before that, it was just a little bit of alcohol. It was just a little bit of marijuana. It was hiding things in his back of his speaker system. And then 15, he got addicted to heroin, and he died at 21. They've devoted their lives and created a foundation to help other families and also to increase access to the drug that can help revive a person who has overdosed. So they're going to talk about that. Detective Jackie Pagan. She has been with the Arlington County Police Department 27 years. She's from New York City. She's been a school resource officer for the last 8 years, and she covers this school, Kenmore, Campbell Elementary, Carlin Springs Elementary, St. Agnes, St. Anne, and St. Thomas More. I hope you're not the only one. That's a lot. That's a lot of coverage. She's also the safety patrol coordinator for all of Arlington. Vanessa Zoria Zuniga is a licensed professional counselor and certified substance abuse counselor. She focuses on psychology. She's also a child and family therapist in Arlington. Lynn Ni has 20 years of clinical experience and has provided college counseling, community and mental health, and home-based services. He supervises an outpatient unit in the Behavioral Health Bureau and serves as the Director of Prevention Services in the county. Norma Jimenez has a psychology degree. She's also an expert in marriage family therapy and a licensed marriage and family therapist. And she has been with Arlington County DHS for over 20 years, where she serves as a bilingual therapist and became a mental health clinical supervisor in 2015. And finally, last but not least, Suzanne Somerville, who I believe put this panel together and did the hard work behind this evening. She is in the Bureau of Residential and Specialized Clinical Services in the Behavioral Healthcare Division of the Department of Human Services here in Arlington. She's the clinical manager for the drug court, as well as oversees the addiction corrections treatment and mental health programs in the jail, abusers intervention program, Clarendon House, and a few others. So thank you so much to our panel. Let's begin with the questions that people from the last town hall wanted to know, and that is, what exactly is Arlington County doing to protect our kids from this epidemic? Who wants to tackle that easy question? Suzanne?
Thank you. Good evening. So this became obvious. I've worked with adults my whole career, but became obvious that we were having a problem in the county when 3 of our finest officers approached my supervisor, John Palmieri, who's the division chief for behavioral health care, and said, we're having a huge increase in the number of opioid overdoses. What can we do about this? So we built a stakeholders task force to address it. And in doing that, we realized what we really needed to do was also to look at prevention. So not having ever worked with children, I dove into this and have found many amazing resources and collaborative people to work with to look at what's going on. So I'm going to ask Vanessa in a minute to talk about the school piece, and also Lynn and Norma to talk about that. But I'll say one of the things that we're really trying to focus on is recognizing that the best way to stop people from getting into an opioid overdose is to prevent them from ever using in the first place. And our goal is to identify what we have maybe in the past looked at as minor drugs, marijuana, alcohol, those type of things, and acknowledge that if people start using at an early age, the chance of them developing a significant problem is much higher. If they start using at all, their chance of developing a problem is significant. So we're really trying to target that, and this program is in fact a part of us trying to target and educate the community and work on prevention.
Good evening. My name is Ms. Vanessa Zuniga. I am a substance abuse counselor here at APS. There are 6 substance abuse counselors, and I will go ahead and introduce them right now. We have Mr. Edgardo Santos, who is assigned to Wakefield High School and Arlington Mill Community High School. We have Ms. Maria Luisa Ceballos, who is the Washington Lee substance abuse counselor and also Langston High School continuation program. We have Ms. Siobhan Bowler, who is a substance abuse counselor at H.B. Woodlawn Middle School, H.B. Woodlawn High School, and Williamsburg Middle School. We have Ms. Jenny Sexton, who's Kenmore Middle School substance abuse counselor and Swanson Middle School substance abuse counselor. We also have Dr. Mila Vasquez-Gatsky, who's not here, and she's assigned to Yorktown High School and New Directions Alternative High School. And I am at the Career Center, Gunston Middle School, and Jefferson Middle School. We're also, myself, Ms. Sexton, and Ms. Bowler are assigned a cluster of elementary schools so that we can provide ongoing support and resources throughout the school year. But in essence, what we do at the schools, our job duties can be divided into 3 categories. We provide education and prevention, which consists of presentations to parents, to faculty, and to students. We focus a lot on teaching them about the current trends, the effects that it has on the adolescent brain, as well as strategies to manage the pressures to use. Additionally, as substance abuse counselors, we have 3 prevention initiatives that we do throughout the year. And that includes the Red Ribbon Campaign, National Drug and Alcohol Facts Weeks, and Substance Abuse Prevention Month. The second category of what we do as substance abuse counselors is screening and early interventions, where we provide supportive counseling to students who are referred to us because of a substance use-related incident. When we meet with students, we screen to determine the level of risk for developing an issue with substances. We attempt to rule out any underlying emotional issues and make recommendations based on the assessed need. Students usually get referred to us by an administrator or a concerned faculty. Other times, a parent may call us, reach out to us, and ask if we could provide supportive counseling to their child. But once we get that referral, our meetings with the students are completely confidential, as we adhere to a federal regulation code, CFR 42 Part 2, which basically says that information may only be shared with a signed consent for release of information. We would prefer that the student, 13 and older, and the parent sign that release before we share any information with an administrator, with a teacher, or with an outside provider. If a student gets an out-of-school suspension for a substance-related incident, and they choose the alternative to a suspension program called Second Chance, the substance abuse counselor will work with the student and the family to orient them to that 3-day program, ensure a seamless registration process, and also follow up with the student after they complete the program. We also provide supportive counseling to students who are stepping down from a residential treatment program and would benefit from support to implement that relapse prevention plan. In the final category of what we do, it's consultation, referral, and linkage to community resources. We're available for confidential consultations if you have questions on how to access adolescent substance abuse treatment services at the outpatient level, at the intensive outpatient level, or the residential treatment level. We have compiled a list of local resources that offer treatment services that not only address substance use disorders, but also co-occurring issues, where they're addressing both the mental health and substance abuse concurrently. Additionally, we can provide a list of local self-help groups, 12-step groups such as AA, NA, and Al-Anon that can be helpful for families that are starting the recovery process. But if you have any questions or would like additional information, please stop by our table at the end or reach out to us at one of the schools. We'll be more than happy to walk you through the process. Thank you.
We'll have time to hear from everyone. I just saw your brother's picture on the screen, so I wanted to give the Outwoods an opportunity to share a lot about Chris and what happened, what you learned from it, and what you're fighting for now.
Good evening, everybody. It's good to see so many of you here tonight. Let me just start by asking, how many of you are parents of school-age kids? Well, quite a number. And I want to address my remarks particularly to you folks, but I'm coming from a perspective that I suspect you don't really want to hear, and that is the perspective of someone who has stood by helplessly as someone that they love more than life itself has been captured and brought down and ultimately killed by this diabolical disease of addiction. For 6 years, my son Christopher battled a heroin addiction, finally passing away 5 years ago at the age of 21. So I want to tell you a little more about what led to that, but first, more than anything, I want to let you get to know Christopher a bit, and I wish I could show some pictures so you could get a little bit better feeling, but more than anything, I believe that will show you just how insidious and hard to identify this disease really is. Christopher was the anti-stereotype in just about every way. He was the all-American boy, big, extremely good-looking. He kept himself in great shape. He was probably the most charismatic individual I've ever known. And because of all this, he was extremely popular in school. He had this 50,000-watt smile that could just light up a room, and he knew how to use it to good effect on young ladies. I think the most notable thing about him, though, was his incredibly sharp and quick wit and his zany sense of humor, which one of his friends described as perfectly inappropriate. His practical jokes were the stuff of legend, and he seldom missed an opportunity to embarrass me publicly, although usually there was a very good lesson to be learned somehow. But all this tended to obscure the fact that Christopher was actually an incredibly deep person. I can remember some wonderfully deep conversations that we had, particularly later on in his life. He was extremely sensitive and very caring, particularly for those who he understood to be going through their own struggles. For example, in school, he always reached out to the kids who were excluded, the mentally or physically handicapped kids, and would bring them into the cool crowd. And they loved him for that. Even just a year before he died, he walked into a men's room late one evening and happened on a young man about his age with a razor blade to his wrist. He was about to commit suicide. And they sat there on the floor, and Christopher talked to him and listened to him for an hour, and by the time they were done, the kid was laughing. But this sensitivity that he had was born of some real suffering. Not only suffering from the addiction, but even before that, and something that led to the addiction. What we didn't realize was that Christopher was suffering from depression and anxiety and ADHD. He did such a good job of covering it up, you just would never expect that. He was kind of a wild, fun, zany kid, very creative, but you wouldn't think that this was going on inside of him. But this led him, like so many others, to self-medicate. You know, a lot of people think that people who use drugs are trying to get high, they're chasing the thrill. But most of the time, they're just trying to feel normal. They're trying to feel like most of us feel most of the time. So by the age of 14, he was in middle school, and Jenny Sexton was his substance abuse counselor. He was trying all different kinds of drugs. There just wasn't much of anything that he didn't give a try to. But by 15, he had become firmly in the grip of heroin. And from that point on, all of our lives became an emotional roller coaster. Probably the scariest part was right at the beginning when we were trying to come to grips with this thing that had suddenly taken over our beautiful son and brother. We didn't know where to turn, we didn't know what to do. We knew we had to do something, but what? It was very much like being lost in the jungle in the dark without a flashlight. Now that's actually happened to me on 2 occasions, and I'll tell you, this was incredibly scarier than that. He had been caught by the police with a residue of white powder in an envelope. And we all knew what that was. Of course, everybody knew what that was, but there wasn't anything that they could do about it until the state lab had processed the sample, and it took them 6 months to do that. So they couldn't bring charges, couldn't get their hands around him, and during that time, we just had to watch helplessly as his life absolutely spun out of control. It was terrifying. We went to county and state officials, the juvenile court officials, saying, isn't there something that you can do to take him in and put him somewhere where he can't get any worse? But there really wasn't anything that we could do. But finally, we were able to convince him that he needed help, and he voluntarily submitted himself to rehab. Well, this was the beginning of quite a chain of rehab experiences, 6 of them in all, of varying levels of effectiveness. But this is a familiar cycle to people who deal with addiction. They have their rehab, followed by a period of sobriety, followed by a relapse, sometimes trouble with the law, and then they start all over again. And this, by the way, is why, if you look at the statistics, you get the impression that rehab is extremely ineffective. Well, it's not quite that simple. The problem is that hardly anybody can make do with just one rehab. They may have to go to multiple, 6, 8, sometimes 10 experiences in rehab before finally it takes root. All of this was extremely hard on him, but most of the time, over the last 4 years of his life, he really seemed like he had a grip on it. He seemed like he was making great progress in his life, and he really was getting better. Only just the subtle hints from time to time told us that maybe things were not quite the way they seemed. And I got to tell you, it is very difficult to find if somebody is really relapsing. You'd think that you would know if your kid was high or not, was on drugs. I never could tell. I really couldn't. And ultimately, after really struggling and trying so hard with this, at the age of 21, he overdosed in February of 2013. It would have been very easy and very tempting for us to just give up hope at that point. That simply was not an option for us. It was not open. We knew what we had to do. We had to continue the work that he was already about, reaching out and trying to help people who were going through the same struggle that he was experiencing. Ginny will tell you a little bit more about the Chris Atwood Foundation, but let me just say that it has been a journey that we never would have signed up for, but it has been so incredibly and deeply rewarding on so many levels. And I'm happy to report that there is hope. We wouldn't be here if there weren't hope. That's what we're all about. And we see this in the lives of people every day that we deal with, who are working day by day with a very difficult struggle, but they're on the uphill path. There never was a time when I wasn't proud of Christopher, not because of anything particularly he was doing at the moment, but just because of who he was. And I feel that through his foundation, God is actually using him, even now, to bring some light and hope into some very dark places. Ginny can tell you a little bit more about how we're doing that.
Good evening. Thank you all for being here. My name is Ginny Atwood-Lovett, and I'm the executive director of the Chris Atwood Foundation, which, as you heard, was founded in memory of my brother. And I wanted to highlight a few of the gaps that we slipped through as a family. and then talk a little bit about how the Chris Atwood Foundation is trying to fill those gaps for other families. So the first glaring gap that really struck our family, and you heard in my dad's telling of the story, was that Christopher had many different mental illnesses and conditions that were affecting him, that were making life harder for him, that he hid very, very well. He was a grade A actor. But why did he have to hide it at all? And that was because of the stigma, of course. Not necessarily the stigma of addiction, because he hadn't really gone down that path yet, but it is the stigma of mental illness. And I think that that's something that is so interwoven with the stories of addiction that we hear. Most of the students, most of the kids, or whoever that's getting addicted, the majority of them have a co-occurring mental illness as well. So maybe if we had a culture in this country, in this state, in this county, that we could all openly talk about mental illness, he may have felt more comfortable talking about that before it got to the point where he began self-medicating. So we openly speak about that part of his story in an effort to encourage people to be open, talk about it, ask people how they're feeling, and dig for a real answer, not just the, oh yeah, I'm fine, and then they go home and cry themselves to sleep every night, right? So we need to be having these conversations. The second problem was that despite the fact that Christopher, in the last 2 years of his life, he really, really stabilized. The 4 years prior to that were a roller coaster. He was disappearing, he was ending up in the juvenile detention system. All of these horrible things were spiraling out of control, but in the last 2 years of his life, he really stabilized on a medication called Suboxone. He started getting his life back together. He was going to support group meetings almost every single day. He was going to the gym almost every day. He went back to school, which we weren't sure he was even going to be able to do, and he was in the process of looking for a job. So things were going really well while he was on this medication, which many, many people need this medication to survive their addiction. Just like somebody who has hypertension takes medication, just like somebody who has diabetes takes insulin. Many times people need to take it long term, and that's okay. That's how you treat chronic diseases. Unfortunately, there's a big stigma out there against people who are on certain types of medication for addiction, because they say that it's using a crutch, that people who are in his community, the recovery community, at the support group meetings that he went to, he was hearing from them that, oh, you're not really clean because you're on that stuff, so you need to get off of it. And he wanted to fit in, he was a people pleaser, and so he went off of his medication before he was ready, and he was dead within 2 months. So, when we say that the stigma of addiction and the stigma of mental illness are deadly, we mean it. It was extremely deadly for Christopher. So that's another thing that we advocate a lot for, is for the destigmatization of people who need medication to survive their illness, and we fully support the use of that. The third major gap that we fell through is that despite the fact that Christopher went to, as you heard, 6 different treatment centers, and one of which, by the way, was $1,000 per day, not covered by insurance. So we were even lucky that we could do that in the first place, but none of the treatment centers told us about naloxone, which, if you're not familiar with naloxone, it is a medication that reverses opioid overdose. So it can be given as an intramuscular injection or as a nasal spray, and it deactivates the effects of the opioids. So it can take people from laying on the floor with blue lips and blue fingertips, not breathing, to up and walking and talking, sometimes in as little as 30 seconds. So it's really, they've nicknamed it the Lazarus drug because it seemingly raises people from the dead. Everybody should be carrying it. The U.S. Surgeon General, if you missed it, a couple weeks ago, released the very first advisory from that office in over 13 years, requesting that community members start carrying naloxone so that we can be lay rescuers out in the community and save people. We have had a lot of progress since Christopher was alive, but unfortunately none of the treatment centers told us it existed. So when I came home in February of 2013 and I found him unresponsive, there was nothing I could do but call 911 and wait. You know, and would things have been different if I had had it? Maybe. But I think that also highlights the stigma, because if this was any other disease, I mean, imagine, you know, if you had a child, and maybe some of you do, with a potentially deadly allergy, and, you know, you took them to the top of the line allergist in the country, and they didn't tell you that EpiPens existed and make sure that you have one. I mean, how mad would you be? It would be preposterous to even think about, because it just wouldn't happen. You know, it would be considered medical malpractice. But we see things like this happening all the time. People are calling addiction a disease, but not treating it like one. So we have made it our driving mission at the Chris Atwood Foundation to try to make sure that nobody else finds themselves in a situation where they need naloxone and don't have it. Because let me tell you, it sucks. So we started offering Revive trainings throughout the area. Revive trainings are about an hour-long emergency response training. Everybody gets a free kit, and if you come to one of our trainings, you can also get free naloxone. And we are offering that to anybody who needs it, and many more people need it than they realize. It's not just for people who have a known opioid addiction. It's also for anybody who's got opioids in their home for any reason. Accidents happen sometimes. You know, these medications are prescription painkillers are very strong. A kid might get into the medicine cabinet. You know, a elderly patient might take their dose in the morning and then forget and take another one, and they can overdose. So we really want to normalize having naloxone available. Going to a class and getting trained doesn't mean you're ousting yourself as somebody who uses heroin or that somebody you know does. It's just we are in a nationwide state of emergency, so we all need to, you know, do our part and be prepared for it. So I highly urge all of you guys, since you're here tonight, you obviously care, sign up for a training. We offer regular trainings throughout the month. At our booth out there, we have a flyer that lists the training times. And the community services boards and the health departments throughout Northern Virginia also, many of them offer trainings as well. So I guess I will leave it at that, but I'm looking forward to your questions at the end. I think that's the best part, you know, hearing from you guys what you want to know. So thank you.
The Atwoods recently, or Ginny did, sat down with me for an interview for a story that we're doing about addiction. And so when she said, I want you to see pictures of my brother, and Mark, you said that too, I want you to see video and pictures of my son, we'll have that and try to capture some of his spirit and the wonderful work that you're doing. I know we didn't get to hear a chance from Lynn, so would you like to make a comment, and I can bring it over to you if you want. And one of the questions I had too is, a lot of people are told that if your child is addicted, it can take 2 years to overcome an addiction. And if residential treatment programs are just 28, 29 days, what happens? How do you support them the rest of the time when they come back home?
That's a good question, and I'll answer it in time if I may. I want to lead in with some prevention talk and then lead to our treatment component of our continuum of care at Child and Family Services Behavior and Health Bureau. I want to again thank you, the Atwoods, for being here. I'm very sorry for your loss. I was very moved by your talk, and I am very humbled by your strength, by your bravery, your resilience, and your grace for the work that you're doing. I appreciate that. So quickly about prevention. So I oversee a small program that is prevention services for the county in the CSB and the Community Services Board. And the program is fully funded by the block grant that comes from federal down to the state to address substance abuse issues and to promote behavioral wellness in the county. The grant funds 2 full-time staff. And how we do our work is we use what's called strategic prevention framework as an evidence-based comprehensive program that looks, that fully assesses what the needs are, what our capacity is. There's a planning, implementation, evaluation, and we sustain the program through cultural competence lenses. The program is very data-driven. What goes into our work plan, strategic plan, is mostly data from the Youth Risk Behavior Survey that was just collected in 2017, and my partners, Kim Duran's team, has a table full of those data. So if you haven't seen it, please stop by and pick it up. It's colorful and very, very telling. So how do we do prevention work in the county with just 2 staff, right? So we collaborate quite a bit, and we depend on our coalition. So my partner in crime is the Partnership of Children and Families. From there's a Teen Network Board. We work closely with the READY Coalition, which is the Reduce and Eliminate Alcohol Drug Use by Youth Coalition. And we work with Arlington Public Schools, prevention specialists, and we meet with the admins to collaborate and to expand a lot of our prevention programs. We also work with Court Services Unit, for example, through the Young Achievers program. We work with August House to implement, towards no drug abuse and evidence-based program at one point. So our work plan prioritizes 4 areas of needs per what the data tells us in terms of what Arlington youth need. The first one, as you may guess from this talk, is marijuana. Our numbers are very high. The second area that we focus on is to reduce underage drinking and binge drinking specifically. We are starting to roll out a program where we are at the courthouse monthly, where first-time drivers are, required to be at the court with the parents to get their licensing. So we're kind of capturing them with a table of information and provide some education there. And the third, which really stands out for me, is the issue of vaping. You've all heard about juuling. That's a huge issue right now. Our cigarette smoking has gone down. The combustible tobacco has gone down, but that is still an issue that we're addressing. We have a program where we do vendor education. My staff and I mapped out the whole county. We drove down every street of Arlington to map out tobacco vendors and vape shops and what we do there. Yes, thank you. This is the Juul. Very cool looking. Looks like a USB drive thing. This is how you charge it. This is the capsule where the liquids are in. It's supposed to be one-time use, but you can YouTube and find ways for you to recharge it or refill it with your liquid of choice. So that could be marijuana oil as well. It is, I'm sorry, I'm jumping to Juul now. We just came back from a prevention conference, and the Truth Initiative gave a really good talk on juuling. And so this is so big now, nationally and in Arlington, that the sales for Juul, for example, for the first 2 months of this year was 54%. So they account for 54% of earnings in all electronic nicotine delivery systems. So it's such a big company. And it's so concealable that you can see kids are smoking in class. And I think our numbers is maybe about 10% had reported that they smoke on school property. So they can take a hit and then blow out the smoke in their sweatshirt or their shirt, and the teacher would not see it, right? Also, what is dangerous about Juul is that the nicotine content is so high. There's nicotine in all capsules, all the flavors got nicotine in it, and the absorption rate of the nicotine is just as fast as the regular cigarette, right? They'll get just a hit, just as strong as a cigarette. Another thing about Juul, and I'll move on, is that within the Juul, the device, there's what's called near field communication, NFC, where the Juuls can communicate with one another, right? So they are communicating, so it's like a social thing that they're communicating. And Juuls is they're very smart. They work with lots of IT folks to develop these things. And they have a program now with all the complaints about kids smoking Juul. Juul is saying that, well, this is not made for children. It's not made for under 18. And here we have a prevention program for you. So the program is called the Juul Labs School-Based Prevention Program. Juul is offering every school that implements their program $10,000 to come to the school and implement a prevention program. And what they do is they actually geomap, the school, and they can press a button to disable all the Juuls on school ground in that moment. So what? Yes? Well, this is we have to be careful. What we're sorry, I have to do a Marco Rubio thing for a second here. I'm getting thirsty. We caution against the program because it's the same tactic that the tobacco industry used when they first started, right? When they first started selling a lot and people are complaining about the negative effects, and they come out with the other side that, no, we're actually helping to prevent this, and here's the money to do that. So we're very cautious right now at the state level in terms of, don't just jump on it, and we don't know what else is, going to be distributed in terms of information about Juul. So
Are we exploring this, or are we just being cautious?
from the state's prevention directors.
In Arlington County?
Yes. I don't know if any school in Arlington has been approached by Juul Labs. I don't know that. But from the conference, we're hearing that if you're approached, make sure you get in touch with preventionists and see what's going on there. Yes.
This drives me crazy. Are you kidding? We have this option now, and you're hesitant to use it? If you used it tomorrow morning at Yorktown, the school would blow up with lights. I mean, why are we waiting? There's no hesitancy here. You can turn it off. I don't understand the hesitancy. This is why things are not moving fast. My daughters are offered Juul hits every single day. They're offered codeine. They're offered the Ativan from the parents. Medicine cabinets. This is a really big deal, and I don't see why you're hesitating.
Well, do we have any schools? Do we know if any schools has been approached by Juul Labs? Okay. Yes.
Right, so let's try to, I know we're all passionate. I'm a mother of a teenager also. I was the first TV reporter in the country to report on Juul and the abuse and the way it's being used in schools. I can give you the name of the Juul Labs people and put you in touch with them if you want to take the matter into your own hands. Arlington County obviously will look at this. What's so insidious about it is that Juul's profits were up 600% in between 2016 and 2017, and almost no adult had heard of a Juul. So we know that our children are the ones abusing it. Also, the FDA has drop-kicked oversight of e-cigarettes and Juul from 2018 to 2022. Now, in the meantime, last week, the FDA did step in and send warning letters to Juul, so did members of Congress. So this company has finally come to the attention of lawmakers and regulators. So even though the regulations won't kick into effect until 2022, and all these things can continue to create nicotine addicts out of our children, the FDA is finally starting to step up. But I can help you contact that company. But you're right to ask if Arlington County is going to take advantage of that offer. But like you said, the cigarette companies did the same thing. They're happy to push for pro-cessation programs, but then still have you buy their product. Also, I found out, and we put this in a report I did last week, because a lot of adults say, who are passionate vapers, they say, well, vaping saved me from cigarettes. Vaping's safer. Well, we don't know the damage that vaping can do yet. And you can find studies on both sides. The Royal Academy in the UK says vaping is 95% safer than cigarettes. And then you also find the American Cancer Society that said we do believe vaping is safer. But then the US Surgeon General says no, there are toxins in there, and we have yet to see the full effect. So you can find studies on both sides of this issue. Did you want to finish up your comments? And then we also need to hear from Detective Pagan. Yeah. Question and answer later. Okay, Detective Pagan, would you like to jump in here? Sure. Okay.
So I'm Jackie Pagan. I'm the SRO here at Kenmore, as she said earlier, and a few other schools as well. Basically, I'm here to tell you guys what it is that we do as school resource officers here in APS. And there are 13 of us within the county, and we take care of these schools in a number of ways, to include supporting the teachers as well as the students, collaborating with different organizations, especially our substance abuse counselors and our regular school counselors and so forth. One of the things that we deal with in collaborating with the substance abuse counselor is that it allows the students to see us in a different light and be able to approach us if they feel that they have a problem and they need to speak to someone. And here at Kenmore, that's been pretty successful. I've had kids come to me for all sorts of reasons and so forth. They see Jenny and I together and coming up with different things for them. And they are ready to help out and to speak up and to join in, which is great. Some of the things that we have seen as far as kids experimenting and so forth, just a lot of the packaging that was shown, the different places that they can hide things. You guys as parents may want to double check your credit card receipts and statements. You may want to double check your Amazon accounts and all those other accounts that you use, because we have had kids that will purchase all these things like the jewels and stuff like that, and the items to conceal all this stuff using your credit card, using your Amazon account, and you don't even know it. We've even had kids purchase other things that were illegal, and if you don't check, you're not going to know. Make sure that you know your kids' whereabouts, who their friends are, who their friends' parents are. Make sure you get phone numbers and so forth. Go through their phones. Go through their internet accounts, their social media accounts. Unfortunately, our kids are in the mindset that it's a matter of quantity versus quality. So they'll have 5,000 followers, but not know 5,000 people. And so you guys really need to look at that stuff, get their password, take their phone away and go through the phone. It's your phone. It's on your account. You bought it. You spent the $800 on it. They didn't. You pay the bill. Look through it. And again, make sure that you know where they are, where they're supposed to be. We've had kids tell their parents, oh, we're going here, but they're actually in the woods. And the reason why they're in the woods is because they know that there's no supervision. They know that they can experiment over there without getting caught most times. And the thing is that they don't know what they're experimenting with. And so that can become very dangerous. And how many of you guys know for a fact that your children walk around with an actual ID card to identify them? Most kids don't. So if something were to happen to them in the woods, their friends are going to panic and run. Your kid is going to be left there. And God knows when they're going to get found for help. So we need to encourage our kids to speak to us and to be open. Encourage our kids to introduce us to their friends and their friends' parents. Make sure that you look through their accounts. Make sure that you look through your own accounts. And also know that over here we have Glen Carlin Park. Our kids have a tendency of taking that as their so-called shortcut. I had former Kenmore kids take us through that shortcut. That's not a shortcut. It really isn't. It is extremely isolated. There are no people over there, very few people, to be honest. It's very isolated, no supervision, and once again, that's where they get into the most trouble. And that's usually why they're late to get home and so forth. And so many of you parents are working, So these kids have a key to their home. So when you think that they're home, they're actually still in the back, in the park or in the woods or something. So make sure that you tell your kids that they need to stay in an area where it's heavily populated so that if they need help, they can get it. They're not going to get any help whatsoever if they're in the woods and something, or by the creek or anything, if something happens to them back there. We've had plenty of things here that take place outside of school, whether it's during the summer, on the weekends, on a holiday, and the school ends up finding out about it Monday morning, and then we have to deal with it. Also encourage them that if something happens to them during that time when they're not in school, that they can actually call 911 if it's an emergency, or give them the non-emergency number if they feel the need to speak to an officer. They shouldn't have to wait to get to school to talk to one of us.
I wanted to introduce a representative from the office of U.S. Senator Tim Kaine. Gaston Arauz, are you here? Okay. So Gaston is with Senator Tim Kaine's office. Thank you for coming. And it sounds like some Virginia parents might like Jewel Labs to come here and do the disabling, and maybe the senator would have some influence there. So one other thing I wanted to add was when I was mentioning about, you were mentioning as well, the tactics, old tactics of cigarette companies and now Juul. The cigarette companies are now investing in Juul. So the #1 maker of the e-liquid stuff down in Richmond, their #1 investor is Philip Morris. So this is the new generation of addiction. And it's the first level. It's the first level. Why don't, if we have questions, comments, please do come up to the microphones here. I know some of you are very passionate about this, and we applaud the squeaky wheels here. So that's how stuff gets done. I'll tell you, okay, sure. I'll let you know when I did the report on Juul, I asked Arlington County Public Schools to supply a drug counselor from a certain school, and they said, no, we don't want to make it look like that school has a problem. I did the story anyway, but I didn't get the support of Arlington County Public Schools on the Juul story, which we were, again, the first television station in the country to cover it, and now you've seen many, many, many reports, hopefully, across the country. So be the squeaky wheel, push, educate yourself like you are today, and ask for the change that you want and that you hear is available.
To reiterate the squeaky wheel and to further your comments about parents being in touch with one another, knowing where their kids are, that was also a part of Christopher's story. So unfortunately, he was introduced to heroin at a friend's house, and that friend, who was also a freshman in high school with him, had an older brother who had gone to college and picked up a heroin addiction, and then came home and introduced his little brother and my brother to it in this home. And the mother knew that her son had a problem, but she didn't tell my mother, hey, maybe my house is not the best place for your child to be right now. So, a big part of that is the stigma, I'm sure. She didn't want to, oust what was going on in their family. But that's a reason why it's so important for parents to communicate with one another and have the difficult conversations, stigma or not.
We did, when we didn't get participation here, we went over to Fairfax County and McLean, and they did provide for us anyone we asked for. They had a parent meeting much like this, where parents were learning about different paraphernalia and ways to intervene and what to look for and to be awake. I was just at a friend's house the other day looking for toothpaste, and I opened the drawer and there was a bottle of water in the drawer, and I closed the drawer and I thought, that's a weird place to put a bottle of water, and opened it back up and smelled it, and it was alcohol. So often as parents, it's just a matter of being inquisitive about the next thing. And instead of, I don't take my daughter's phone and insist on having her password, I go through it with her. I sit next to her with her, and we look at the posts together, and we talk about what she wrote or what someone else wrote. Snapchat, as you know, is a little more problematic because it disappears. But it's all part of that open conversation with your child, and having them hopefully feel comfortable enough to be honest with you and tell you some of that hard stuff. So Anyone else on the panel want to add? Yes.
So I'm here to tell you about what do we offer at Behavioral Health Bureau. Our services are especially designed for youth with serious emotional disturbance. We call it SED, but what this really means is having a mental health problem that are severely disrupting daily life and functioning at home, at school, or in the community. This also can include alcohol or other drugs abuse. Our services are also targeted for kids who are at risk of developing serious problems because they have experienced trauma or have been affected by the substance use or other impairment of a parent or a family member. We provide screening and diagnostic services, information and referral, consultation triage to screen for needs, and court diversion intake, as well as detention and school-based services. We do that at Carlin Springs Elementary School. We just train our staff to use SBIRT, which is really a screening, brief intervention, referral to treatment. This is an evidence-based universal screening tool for for substance abuse, and is strongly promoted by the Substance Abuse and Mental Health Service Administration, which is SAMHSA. We're exploring implementation beyond the Bureau, such as community medical health. We also offer individual, family, and group therapy using evidence-based treatment approaches. This means that approaches have been tested and have shown to have positive outcomes. We use cognitive behavioral therapy, trauma-focused CBT, motivational interviewing, and expressive modalities such as play therapy, art, and Sandtray. We do also offer case management for transition to young adulthood, psychiatric services, medication management, psychological evaluation, parent and child assessment, substance abuse treatment, substance abuse prevention, mental health promotion, behavioral intervention services, and provide a variety of psychoeducation groups to include parenting classes. Our treatment is really centered on the needs of your kids and your family, and we integrate mental health and substance abuse conditions, and we refer to these as co-occurring. So we work with the family in a holistic way. We provide 2 psychoeducational groups for parents whose children are receiving substance abuse treatment. One group is for the parents, because we think that parents need to know what's going on. We teach them about the impact on adolescent development. The parents are taught the warning, the signs and symptoms, and they're also taught how to support their child in the early recovery and learn relapse prevention skills. This group is also offered in English and in Spanish. We also have a multifamily group where parents, we do it together. So it's an excellent opportunity for both to be able to learn relapse prevention and incorporate it in their lives. Now let me talk about the treatment groups. We have 2 substance abuse treatment groups. One is using evidence-based strategies to teach early recovery skills and relapse prevention, along with therapeutic, recreational, and mindfulness that that is very important now to incorporate that to teach them coping skills. The other group is more on is more focused on trauma, so PTSD, because we have seen that many of the kids that have mental health are using substances are also having some PTSD. So it has a strong emphasis on helping clients learn to stay safe, to understand the connections between their trauma and the substance use, and how each affects the healing from each other. Each treatment group can be completed in about 6 to 8 weeks, months. And we also have an NA meeting that is led by our peer specialist, Sean Wagner. In situations when outpatient treatment services are not meeting clients' treatment needs for mental health or substance abuse, a referral is made for intensive outpatient services or for a residential treatment center. Contact is obtained with a client through case management services to ensure the client is receiving identified treatment services and to coordinate discharge, planning, and help client transition into the community. And we usually call the school, and we work very collaborative with all the staff for substance abuse. The last thing I want to say is that treatment helps kids and families learn how to tolerate these stressful, uncomfortable feelings, and we help them develop healthy ways to manage those feelings instead of unhealthy ways. Parents are the partners in our treatment process. You are the experts on your child. We need your input and your relationships with your child in order to make a change. So I would encourage all of you to break the stigma of mental health and substance abuse and be heard. Thank you.
We recently had a situation in our community where a freshman in high school came back from rehab, and the father called all of the parents of the friends that he knew about and said, I want to tell you what we're going through and what my son's going through and how you can support us. And I thought it was amazing and remarkable that he did that, and I appreciated it so much, to your point. Because when I talked to some of the teens who are friends, they said, we want to help him. We want to succeed. We're afraid the second he's allowed to go back to a party, he's going to relapse. We don't want that to happen. So that's the part of letting go of the stigma. And then thank you for letting us know how many resources there really are in the county. I'm assuming that for parents, they can contact the drug resource substance use counselors at the high school for these referrals. Please, sorry to keep you waiting.
No problem.
Your question?
I'm wondering, to get back to the Juul device and vaping devices in general, what is the APS policy, and/or is there a applicable state law regarding if a student is discovered to have a Juul or other vaping device on school grounds?
So the APS policy on juuling or e-cigarettes, this actual school year was changed so that if a student is found in possession in the school with a vape, if they're using it or in possession, they get an out-of-school suspension. They have the option of using Second Chance. Second Chance is an alternative to that suspension where you participate in a 3-day psychoeducational group where you learn about the negative effects of juuling and other drugs. You also get to hear from SROs about your rights and what would happen if you get caught with a Juul in the community. And at the same time, you also hear information from Commonwealth attorneys and defense attorneys about what they've seen out in the field with kids using Juuls. The parents also have a workshop or presentation that they attend, so they're informed about what their kids are learning. And in addition to that, 6 weeks down the line, there's a booster session where the parents and the students go and talk a little bit about how things have changed since the presentations. Have they talked more? Is there an open line of communication? So the school offers that program to provide psychoeducation for families. So it starts, I'm not sure if I'm answering your question completely, but that's where it starts.
Can I add to that real quick? In addition to psychoeducation, I understand that there's also a pretty thorough substance abuse assessment component to that as well, and then any referral that needs to be made from that as well. But I noticed that there's a table out there for Second Chance, so you may want to stop by and get more specific information.
Fairfax County doesn't have Second Chance, so you go to Fairfax County, and they're talking about how much the fine is, and when you go to court, and it's a criminalized behavior immediately. So Arlington County should be applauded for Second Chance. Now, on the flip side of that, the young man I was just referring to who really has a terrible addiction, his parents didn't find Second Chance helpful. And maybe he was too far gone. So it is an early intervention, and it's, it's a first step. But it's not about criminalizing. It's about teaching both the child and the parent.
Thank you.
Thank you for giving me this opportunity. But I request almost all of you that my English may be broken.
That's okay.
In as much as possible, I will try to communicate to you. And I beg you just to repair, to patch my statements and take the content with a positive outlook. Here it says, do you know Joule? It says here. Of course, yes. It is here. It is at 7-Eleven. It is here. Wherever there are schools, parents, the community members, are we creating safe environment for our kids? Are we discussing problems again and again? Are we not here to hear solutions? Are we here to repeat researches? In 2014, this many people were smoking. In 2013, in 2015. Are we here to hear this? Why do we shy away from problems? We know the problem. We know it. I am here to hear, maybe there are researches being done for a solution. Sorry. You make a fire. You keep your child here, a kid, at the age of 2. You left him and you go away. The child definitely will be burned, right? It's a common sense. I look very foolish to ask you. Our kids until 12th grade, they are like kids. They need our protection. You find it here. You go to Thomas Jefferson. There are 2 7-Elevens. You find Jules.
Sir, if I could interrupt you for a moment. For the first time, the FDA actually has issued this dragnet across the country, and a few 7-Elevens have been caught selling Juuls, and they are stepping up enforcement. So there's good news on that front. It's starting to happen.
Okay.
Everyone here agrees with what you're saying. Do you have a question you'd like to ask of our panel that we could address?
Yes. I'm afraid very soon such drugs will be included in our food menu very soon. I'm really afraid because we are not discussing solutions. We are hammering, nailing problems. We are not creating safe environment for our kids.
That is a really good point.
Yeah,
And I'd like to intercede for a minute.
Once, please.
All right,
It says
one
here,
second.
the drug is killing more Americans than the Vietnam War.
Correct.
Is it not shocking?
Yes, sir, it is. Thank you.
There is
And
no
again, I'd
second-
like to intercede. So thank you very much. We are all here to acknowledge that, and part of what we are doing as a county is trying to come up with solutions. So I'm going to come back to what I started with, which was the Arlington Addiction Recovery Initiative that we created. It's been in existence for a year, since January 2017. And we have made a lot of headway. We've created 6 priorities to try to create solutions, because we agree with you that drug addiction is not acceptable. We do not want this in our county, and we will do everything we can to stop it. So part of what we are doing is prevention and outreach. Part of what we are doing is working, the police are working very hard at reducing the drugs that are on the streets. The prescription monitoring program is essential. We're able to identify if people are getting prescriptions from other places. We are working with prescribers and advocating for legal changes to the way things are written and prescriptions are managed. We are doing naloxone training, as Jenny talked about. It's a very important piece for what we're doing. So we acknowledge what you are saying, and we agree completely that we need to focus on solutions. We need to focus on managing this issue and not allowing this to continue. So thank you for your feedback and for what you are saying. This is the choir, to quote my friend Tom. We are here tonight because we agree with you, and that is what we are focused on. So another program that the Department of Human Services created, and I'm happy to have our therapist here, who I'm sure appreciated me calling her out, is the office-based opioid treatment program, which is our Suboxone program. So Jenny referenced that earlier for her brother and how important that was for him. We had our first graduate from that program. We're really excited. We have some people who have had long-term, very chronic opioid addiction who are now in full recovery in terms of living their lives in the way that we would all consider to be a very contributing member of our community, and that is our goal. So we, I think as a county, are really focusing on this and really trying to come together to identify the weak spots that we have had and to build on that. You heard a lot about what's going on in the schools. It's been eye-opening for me because I really have not worked in that prior, and it's been really exciting to see the partnership between the SROs and the substance abuse counselors and the physical education teachers. There's a lot going on. We ask you as parents, we ask you as community members to be involved. When you see things that are issues, bring them up. Know your children, know what's going on with them. I can't tell you how important this is. I worked in the jail for 12 years prior to transitioning over to our outpatient office. And in working with people who have lost so much of their life to addiction, it's fascinating to me to see how early people started. It was very common to hear people started using drugs and alcohol at the age of 11 and 12. That shocked me initially, and then you sort of get used to it, and that's kind of sad in and of itself. This is a horrible illness, and it is something that we all need to work on. We need to come together as community members and as family members to address these issues. We need to not hide away from it. The stigma is enormous. We have to challenge it, because if we're too embarrassed to talk about our family member who has an addiction, we're not going to be open to doing everything we need to do to save them until it's too late. So I'm tasking all of us to go forward and to focus on this.
Can I make a quick comment to, thank you. A quick comment to respond to the gentleman's concern about Jewel being right around the corner. You know, the difficult thing with Jewel is that when you work on limiting access, that it can be mail ordered. So it's not just our local community. However, I do have something positive to report out that through the Counter Tools program, which is a vendor education program, that when we started this 3 years ago, so every year ABC does a secret shopper thing where they go out to the whole state and pretend to be underage and buy a cigarette. And then they would count on how many infractions, per county. 3 years ago, we were third from the last on the whole state. So there are 42 CS Community Services Board, we're third from last in terms of the highest numbers of infractions selling to underage. Last year, 0 infractions. Last year there was no selling to underage at all, and we can't take full credit for that, but I think that by visiting every vendor that sells tobacco product and vape shops and having a talk with them, educating them on the harmfulness of it and how it's illegal to sell to underage and giving them posters and things to put on the counter, I think that we are slowly, moving the needle in the right direction with that.
If this is an issue that's near and dear to your heart and you want to get more active than just beyond Arlington County, I want to direct your attention to the Addiction Policy Forum. I don't know if you've heard of it before. They asked me to MC their awards ceremony last week up on Capitol Hill, and members of Congress were there. Former drug czar Barry McCaffrey was there as the keynote speaker. Opioid addiction and breaking the cycle is there, all that they're about. And actually mentioned the Atwood family also there, and the room was filled with parents, heartbroken parents from across the country who came up at the end of the night and handed me pictures of their children whom they had lost to this addiction. They had a scientist there from NIH. She is the premier scientist in our country, possibly even the world, who has proven that addiction is a brain disease. And so the Addiction Policy Forum, I would strongly encourage you to look them up. They're an incredible organization doing really powerful work across the country, and they're based here in Washington if you want to get involved on a broader level. Yes.
Thank you. You've asked us to come forward, so I'm coming forward. I'm an Arlington mother. I have 2 sons who I love very much. They are 7 years difference in age. Both of them are facing issues regarding addiction. One is currently in Arlington Public Schools, one is a young adult. I've been personally involved in this issue through my family for more than a decade now. And I look at this group of folks in front of me, and the first thing I think is, we're not investing in resources. 13 SROs, 6 substance abuse counselors. In Arlington, we should be doing better. I'm sorry. And I don't hold that to you folks. I don't know how you even start to do your jobs. But I do know when my middle school son came home from very expensive private addiction treatment, we couldn't even get in to see the substance abuse counselor at his school because the line was too long. I don't know what it is at the adult age, but we've got to come up with some new ideas. We've got to come up with new resources, investing in this situation. You ask us as parents to come forward, and I'm trying to do that this evening, but I will tell you the hesitation that I know I faced, I know others face, is the interface for our children, particularly our young children, between the issues of substance abuse and the issues of criminality. I'm sure it's one that, you know, in the schools is faced. It's very difficult to ask that of a parent, to come forward and realize that you may be risking that your child would become involved in the criminal justice system. I'm just sharing my experience because it's my experience, but it's not mine alone. There's other families. I know that because we talk about it. I'm sure somebody else in this room maybe has a similar one. I want to thank you for what you do, but I really do need to say that we've got to, as a community, encourage new ideas. Because the things we've talked about, they're not working. We've seen the numbers in our schools. They're not working. So thank you for being here tonight, but we've got to do more, please, all of us in the room.
Thank you for having the courage to come forward and share that. And we don't grow without criticism, and we don't grow without real stories. And not to repeat it too many times, but exactly what you're talking about, the Addiction Policy Forum, they reward innovation in communities that are coming up with ways to help with this crisis. They are pushing for decriminalization, and they're working directly with members of Congress on these very issues that you bring up. Who here can address the issue of whether Arlington County has a shortage of counselors, resource officers? Do you feel that way? I mean, we're hearing from a parent who said she couldn't even get in to see a substance abuse counselor. So who can answer that?
Sure, I can respond to that question from the perspective of the Behavioral Health Bureau, which is the Substance Abuse and Mental Health Treatment Service from the Child Service Division, that I've been with the county for 11 years, and we have not had a wait list. Our policy, and we're sticking pretty well to it, is that when you make a phone call in for a phone screening, within 5 days, you will see a therapist for a face-to-face initial screening, and then another 5 days or so for the first face-to-face for the assignment of that client to a therapist. And this is both for mental health and substance abuse. This has been our statistic for the past, a good 10 years. We are also, and this is a soft announcement, but the state is moving towards same-day access. There's a push from the Community Service Board to do same-day access. We've been very successful with our adult side, BHD, and we are soft rolling it out in Child and Family Services. So very shortly, we have same-day access that you show up and you are seen, assessed the same day, and promptly connected to ongoing services. To our Sequoia 1 building, 2100 Washington Boulevard. Yes, we have all kinds of information at our table, including our brochure with the whole spectrum of services and contact information of how to call in and get connected.
I'm going out on a little limb here politically, but since I don't have anything to do with the public school system, I will say it is my sense that we are short-staffed with substance abuse counselors. So I do think that that is something that as a county we can advocate for. I think you were referencing trying to get into the schools substance abuse program. And what I have learned in working with them over the past year is that they're all very dedicated and really want to do great work, that they don't have enough staff to cover them. They're all covering multiple schools. So I think it's fair for you to petition to have more. I'll say that. I want to go back to what you also said about criminalization and just address that piece for a second, to say that we are looking at that as well in terms of alternative sentencing, and or if we can do something that we've been able to do on the mental health side, which is diverting from jail. So we're working on trying to set up some ways to manage this so that it's not criminalization so much as we're getting people into treatment as much as possible. We've created a very close relationship with the police and our treatment staff, and we're creating a network of peers that will reach out to people who have overdosed, and we are trying to do that in a way that we're not getting them arrested as much as possible. We are reaching out to them to get them into treatment. And I think the police and Commonwealth Attorney's Office are working closely on this issue as well, and there are a lot of things that are coming down the pike. So trust that we are aware of that as well.
Okay, so if I think if the issue was that you couldn't get a school substance abuse counselor when your son returned from a residential treatment facility, I wasn't clear if that was the case, but if there's a substance abuse counselor who is swamped with a lot of referrals, our team of 6, we reach out to each other, and we will try to be at that school to provide that support that counselor, that school substance abuse counselor would need. I thought your question was that a substance abuse counselor at an agency, but.
I was just using as an example that I had a middle school child who was in a situation, was put into private recovery, returned to his school. And when we reached out to the administrators, we had a relationship. When we tried to reach, this is not a criticism of a particular situation. It is a comment that there are inadequate resources in our school system for children who are struggling with these issues.
And we now have a website for substance abuse services through APS. There's contact information there. If you're having trouble through the administration,
no, this
call
was
the
just
circuit.
that the person had too many kids that she was working with. She couldn't,
Right. But I'm
manage
saying
another kid.
We're not assigned to each school.
This
to
is
the
not,
point-
please, it's not a
Oh,
criticism.
okay.
I'm trying to be supportive of you.
Yes,
I would like
yes.
20 more of you,
Yeah.
okay? At least. Why shouldn't every school have somebody like you?
Okay.
That's my point as an Arlington resident and as a taxpayer. There should be more
We should get
support.
more. All right.
Okay, so we have a comment here and then a comment here. Go ahead.
Hi, thank you for being here. I think my one observation, not necessarily a question, is if I look at the room and the people that are attending, I think I see one county board member. That's it. I don't see anyone from APS staff or the superintendent, unless I'm missing. We do have a few, but our superintendent is not here. Do I see any APS student, Arlington County School Board members? I think that's very telling about how supportive they are of making a change on this crisis. It's not like this is happening every night. We had one last September. I don't understand why they're not here and part of this panel.
Judy?
Yeah, Kimberly, I just wanted to mention that Arlington Schools has advisory committees, and I happen to be co-chair of the Student Services Advisory Committee, which is, we are advocating for more substance abuse counselors, more psychologists and social workers in the schools, more regular counselors, and we'd love to have you, anybody who'd like to, community member, parent, grandparent, be part of our group. We're looking for people to work with us, and we work with all these people right up here. So please see me afterwards. I'll be out in the hallway. Thank you.
Now, when you say we're looking for people, do you mean volunteers or
Volunteers. This is volunteers, and we meet once a month and work in between on services for students and families in the student services, the counseling, and the substance abuse counselors and all those sorts of areas.
Are you hearing some of the same of what we just heard from this concerned parent, that there isn't enough support in the schools?
We've been advocating for more substance abuse counselors and also more psychologists and social workers and regular school counselors. Yes, and the budget's coming up, the school budget. We're a little late. It's going to be, you can watch tomorrow night and see what happens. Tomorrow night the board will vote, the school board will vote and decide on the budget for 2019. But we can still start working right away for next time.
Well, how much have you asked for, and what's been the response from the school board thus far?
Well, the school board has been listening, and it's a tight budget year, but that's everything. That's the way it is in the county right now, and we've asked for 5 elementary school psychologists and 6 social workers, and we've asked for more substance abuse counselors. I can't remember the number. And we've also asked for more counselors in the schools. So we're working on it, but it takes more help, more voices, and it's not a huge time commit, but we'd love to have people work with us.
Thank you. Thank you for organizing that.
I just wanted to highlight your comment about more voices, and say that absolutely the more people that are advocating for this, the better. Because of the stigma, there's less people in the advocacy realm than you would think. But also, even just one voice, don't think that it has to be, a huge crowd. Sometimes just one voice can make a huge difference. And I found that out personally myself when we started our overdose reversal program, and we were trying to get life-saving naloxone out to people who might walk in the front door and find their loved one dying at any moment. And we had all these difficulties with getting it to people because we had to require that they go to the pharmacy, and then people didn't have the money, and they were afraid to go and identify themselves at a public pharmacy counter and ask for it. And a lot of the pharmacies were turning them away because they said that you needed a prescription. So we had all these problems, and we said, you know what, there's got to be something that can be done about this. And so it started, I had one meeting, just me and my local delegate, and said, we would like to be able to give naloxone out directly at our trainings, but right now only pharmacists can do that. What can be done? And within 6 months, we had gotten a law passed in Virginia that allows revived trainers to dispense naloxone directly at our trainings. And I was amazed because I didn't have any idea how the legislative system really even worked at that point. I had never done legislative advocacy, had no idea what I was doing. I just happened to be really passionate about this one issue, and it got something done. So use your voices.
Before we go on to what will likely be our last comment here, and then please feel free to address some of the people who have spoken up, and then also check in with the police officers in the display and the displays outside. To the point of, if you feel like your child's school doesn't have an adequate number of counselors, you're not getting the response you're looking for, it sounds like the county has resources. You can go to the county. You don't have to go through your school. Correct? Correct. Okay.
Hi, everybody. My name is Mike Scheer. I am an alcoholic. I hear people talking about a lack of resources for somebody to come over to your house. Do you realize that we have a hotline for alcoholics that is person 24 hours a day? And if you need help, all you have to do is call. You know what the cost is for the people to come over to your house to help you with the problem? It's nothing. And you have an expert sitting right in front of you, somebody who has overcome this thing already, and you would be absolutely surprised who's going to show up at your house. People that are your neighbors, that are accomplished, that are living a separate life altogether. If you can't get in to see somebody at school, folks, who cares about whether your kid is involved in the criminal justice system? Their life is in danger. Okay, people die from this stuff. One of the best things that can happen to somebody that's in early stage addiction is that they sit there and spend a couple nights in jail. Let them sit there and pay for what they're doing. Grab somebody from Narcotics Anonymous who has kicked this thing. There's a bunch of people that started out on vape, all right, and they ended up with heroin, and they know how to overcome this thing because they've done it, and they've been clean for years. So if it's a matter of access, you know, call these people. They'll show up at your house. They'll show up at your house at 2 o'clock in the morning. And what we say in Alcoholics Anonymous is that we do it for fun and for free. We give back. All right, we called that hotline and people showed up, changed the whole trajectory of our lives. Get in front of your kids in any way you can. Fight dirty, all right? Whatever you do, whatever resources you can do, when you have the time right now, they're going to grow up. And you aren't going to have the leverage that you have right now as their parents. Use it. Absolutely use it. But this is a free resource.
What is that number?
We have a table out there. It's Alcoholics Anonymous. I've got that number it's sitting on a book. I don't have it right. Well, actually, yeah, I did. It's on my phone. Give me a second. Now, this is the alcoholic one, okay? And it's... I don't know what the Narcotics Anonymous number is, but all you got to do is look it up. All right, it's called Northern Virginia Intergroup. Whoop, I'm calling it. Didn't mean to do that. All right, that number is 703-293-9753.
And you have brochures out here outside.
We have brochures out there, and it's 24 hours, okay? It's somebody that has licked addiction to alcohol, right? It's an expert. It's a certifiable expert. And again, the cost is for free. They'll come to your kitchen table. They will sit down with your kids. Probably the kids are going to get really mad about it. Tough. All right? We're going to be at the AA table, and if you want to talk more about it, love to hear from you. Okay? Did I mention it was free?
Good.
Thank you.
And fun, you said. Thank you so much for that. And before we take our last comment and question.
Also, I don't have the number for it, but maybe somebody up here does. Crisis Text is a free 24/7 text line that you can give to your kids. Okay, what table is that? The Child and Family Services table has information on that, and that's great for kids because I mean, I'm a millennial, and I even prefer to text than call people. It's terrible, but it's the truth. Any time of day or night, if they're having a mental health crisis, and maybe unfortunately they don't feel comfortable reaching out to you or somebody else, at least they have some person that they can talk to. Crisis text line. Yeah, so you text 741741. That's the crisis text line.
Thank you. Yes.
Good evening. Thank you for everyone for being here. My question is this. You mentioned about how early kids start with addiction at 11, 12, and it's shocking. And I think part of what makes it so easy is the availability of drugs on school campus. And that's from personal experience with my own child. And I had no idea because he's that typical good kid that does well in school, has friends. And then later on, when he got caught, I found out that he had been doing marijuana and was getting it from buying it on school campus. So what programs do you guys have, maybe directed at law enforcement, if any, that tries to stop the availability of drugs being sold at school?
Sorry. That's part of the reason why law enforcement is actually, or the SROs especially, collaborate with the substance abuse counselor. These kids are getting these drugs from elsewhere, bringing them in. They're getting them from your medicine cabinet. They're getting them from your liquor cabinet, and they're bringing it in here. Some of these kids will go ahead and take your liquor, put it in a clear bottle to make it look like it's water, and then fill your liquor bottle with water. And you don't know any better. And then they bring it here and they share it with their friends. So it's not like it's in the school, and I get your point, but it's not like it's in the school. It's in the school because it's being brought in by students. And so we try really hard. The administrators have the ability and the discretion to go through lockers. We've tried getting dogs to come through here, but there was a little apprehension about that because there were certain parents that were feeling a certain way in reference to having dogs walk through the halls and checking lockers and so forth. But we really are trying to make sure that we do education. As far as Kenmore is concerned, we've got 100% students having been taught substance abuse issues and what to look for, symptoms, signs, things like that. And some of these signs and symptoms are going to be typical teenager behavior, but you know your own kid, and you also have that peer pressure. So you're going to have kids that are going to ask other kids to hold stuff for them, and that creates a problem. So, it's not, it's not that, for instance, we got a school store outside. It's not being sold there. It's coming in because your kids are bringing it in. They'll go ahead and sometimes they'll have it on their person, and that's part of the reason why they take these so-called shortcuts so that they can take a hit before coming into school. And then, of course, us adults are the ones that notice the lethargic, the falling asleep in class and stuff like that. So we also collaborate with the nurses, and the nurses are really good about helping us out with that too. So, it's the whole community has to come together in order to fight this. I'm sorry, one more time.
My son had told me he's buying marijuana from a dealer. And I don't know if that's another student or a neighboring kid. I'm sure that, kids bringing in from, pills from their parent cabinet or liquor from their, from their parent is part of it. But I know there's drugs on campus are being sold by dealers.
And what we need is for your student to come talk to us. And if, and each student is different. They may not want to talk to law enforcement right away, but they've got so many other resources in the school that they can turn to. So they can speak to someone and they can tell us that this is going on so that we can then take the next step.
But the students are buying it and they come and tell us.
You'd be surprised.
But my thing is, are you doing anything on your part that you're initiating, not waiting for a student to come tell you or talk to you or narc on food and drug use?
Well,
That's not happening.
we don't have the authority to go through someone's locker or someone's person without probable cause, okay? We just don't. But the administrators have the ability to go, like I said, through lockers or call a kid down and have them empty out their pockets and so forth, okay? And again, we work together for that. And the other thing that we do is we try to do diversion programs for these kids, okay? And if it is in fact someone who's really truly dealing, we deal with Vice also. So Vice is a great resource for us, and they help us along with this as well. So I can't just go to one kid because another kid told me that he's selling. I can't just automatically go to him and tell him, empty out your pockets, let me see what you've got. But an administrator can do that. And so I can go to the administrator and say, hey, I've been told that this is what's going on, and so we take it from there.
If we're going to be on time, we have 1 minute left, so please go ahead.
Thank you so much, and I just want to address that comment. I'm hearing a theme about middle school in particular, and I'm really concerned about wanting to address this situation upstream. I have a kid in 8th grade, and I've heard so much from him in his few years of middle school. It's been shocking. I chair the School Health Advisory Board for APS, so I've got my ear to the ground, hearing everything. I'm raising awareness among all the parents that I know, and every time I mention behaviors that I see in middle school, everyone is shocked and appalled, and they can't believe it. So I want to see APS or the police or anyone do more outreach to the parents to say, you know what, we have a problem here. There are children selling drugs on your child's campus. We want to hear about it. Or your child's in 7th grade now. It's time to lock up the liquor cabinet in your house. Why are these kids getting access? The average parent doesn't necessarily think of that, but these are easy messages that could be coming to the school to home on a regular basis. School health can send notices saying, we have an epidemic, this is like a virus, it's spreading, we need you to be aware, we need you to see the symptoms, and we need you to act. And I'm not seeing any of those messages coming home, but all I hear is secondhand information from all the kids that this is going on. And I feel like once they've reached puberty and they're off into high school, we've lost them. They're not listening to us as parents anymore. But while they're in middle school, they're still hearing us, and that's our opportunity to make a difference.
Thank you for your comment. You don't have to wait for the school. In McLean, it was the PTA that put together the program and brought in police officers and asked the school to come and participate. And there were 300 parents in the room educating each other, sharing stories, learning. So you don't have to wait for your school to do it. It'd be great if they would.
But we're preaching to the choir here. It's the parents that don't show up to those events that need to get these messages in email, right, in backpack mail, in peach jar, any way that we can get to those people that won't show up to an event like this, because they're the ones that need it most.
Okay, thank you.
Hi.
All right, this is our final comment. Go ahead.
Just how there are required, mandatory FLE courses, is there a mandatory substance abuse course?
That's a great question.
Not necessarily. The question was related to the mandatory alcohol education. Instead of what there is with that, it tends to be more of sentencing suggestions. So the judges, the Commonwealth Attorney's Office can mandate, probation can mandate substance abuse treatment, and it can be part of the criminal justice requirement. It also can be an alternative sentencing. The addiction correction treatment program is here, and that is a program that's in the jail, that people can get that instead of getting a longer sentence usually, so that they'll get really solid substance abuse treatment and be prepared to come out into the community, hopefully in better shape. DOC has a program for CCAP. So there are different programs, but it's not the same thing as like a DUI mandatory. Oh, I'm sorry. Yes, pretty much. So not for children, let me clarify that, for adults. For children, it's second chance. I'm sorry, I was talking about adults. So that was my mistake. In talking about the children, I think it's more of a voluntary through second chance.
Yes, quickly, I was really happy to hear upstreaming, such a great word, in terms of what we're trying to do as well, that if you look at YRBS data, where does it peak? It peaks at 8th grade. 7th and 8th grade, all the numbers just kind of go up. So how far back up do we go? Up to now, we've done our Mental Health Awareness Month and Substance Abuse Prevention Month. We've done it in all high schools, in all middle schools. This year, we're going back to elementary school as well. So we're communicating with APS and the staff there to coordinate our efforts to have prevention messages, awareness tables at the elementary schools for both of those months.
So through the schools currently, what we have is APS Health Education delivers instruction that provides comprehensive approach involving decision-making, refusal skills, alternatives to drug use, psychological and physiological effects of substance use. So basically you're getting workshops and information through your health and PE classes about some of the dangers of substance use. This happens at the 6th, 7th, 8th grade level, 9th, and 10th grade as well. So you do get a series of, some weeks with information about some of the dangers, the effects on the brain, how to refusal skills. Just trying to see if anything else here. There is a component of education about mental health as well, but I think she was asking about substance abuse, right? Yeah.
Thank you all so much for being willing to be here and express your opinions. I'd like to give a round of applause to our panelists who gave their time and expertise. And they'll be here commingling with the crowd, so if you want to talk to anyone one-on-one, thank you so much. And let's continue the conversation, be one community fighting this together. Thank you.
So my name's Dave McBride. I'm joined by Jenny Sexton. She's our substance abuse counselor. We just wanted to say thank you very much to the Atwood family for coming up and sharing their story. I know many of us, including Jenny and myself, have been touched by addiction and loss, and it's a very difficult topic to talk about. I do want to say from the school's perspective, we are working hard on this issue. There are people who take this very personally and want to make sure that all of our kids are safe. So there's a lot of information available out in the hallway, especially with Second Chance, and your courage to come forward is very much appreciated, and your courage to share that story is very much appreciated. So thank you. We have a couple t-shirts.
Yes.
And also for you.
If I'd known, I would have heard of that family. Yes. That's why we begin to, everybody in DOC would be carrying.
Yeah, no, I know.
Yeah, so here's the next thing. Okay, so we go